Hello, my name is Dr. Brian Reid, and I'm a naturopathic doctor, and this is a video about mitochondrial support. I've talked about mitochondrial support in a number of videos in the past, and it's just such a big part of my practice. It's something that I'm very, very excited about, and I wanted to share some case experience with a patient that I followed up with fairly recently. Because one of the things that can happen in clinical practice is we work with different therapies and we're seeing some positive changes, and then we don't necessarily see those positive changes always lasting. I've had patients where they're, for example, they're getting chelation therapy and they're like, I'm feeling better, and energy levels are improving or pain levels are going down, and it's improving, and then it seems to kind of hit a plateau, or it's helping for a bit and then symptoms start kind of creeping back, or I'm ramping up on my anti-Borrelia tincture or my antiviral protocol, and I'm doing better, and then it just doesn't really fully sustain, and that certainly doesn't happen all the time. We see sustained benefits with those types of approaches on a regular basis, but it's when a therapy is helping, it's always nice to get confirmation that it's continuing to help, or that the problem doesn't just come back. So the patient that I was following up with recently, in terms of her case, she was a case where she'd been suffering from chronic fatigue for probably 20 years or so prior to seeing me. And she was a patient that I started working with quite a long time ago, back before I knew as much as I know now about mitochondrial function and dysfunction and how to address it as effectively as possible. And so we tried working with a number of different things, and over the course of time, different symptoms would get better. We worked with, tested appropriate things and worked with appropriate treatment to help resolve her digestive tract issues. We worked with some other therapies that ultimately she was suffering from on and off, like just whole body itchiness, which must just be awful. And we worked with things to help get that resolved. We worked with some therapies that seemed to help with her energy levels a little bit here and there, but just nothing was really sustaining. And we did so many things. We looked at her genomic profile and subsequently put her on appropriate methylation support and supported other parts of her metabolic pathways, and just didn't really make much of a difference. We did chelation therapy to remove heavy metals. Didn't really make much of a difference. We worked with herbs to help support her adrenal glands, like rhodiola or ashwagandha and borage and things like that. Didn't really make much of a difference. She had all of her conventional lab testing done, of course, did some non-conventional testing, just nothing really seemed to be off kilter in terms of hormones and things like that. And so it was really unfortunate, because we mopped up a lot of symptoms, but she was still suffering from fairly notable fatigue, had to nap during the day, and also fairly notable brain fog as well. If 10 is bad, she was anywhere between a 5 and an 8 out of 10, depending on the day or the time of day. And so her case seemed to be really stuck. And so I put on my thinking cap, as I do on occasion, and I thought, well, we've done so much. We tested her and treated her for Borrelia and Bartonella and co-infections and things like that, treated her for mold. So we did the whole gamut. And so I thought to myself, well, maybe part of the issue is that we've removed all these bad things in her system, but her system is just not rallying. It's like if a community is just ravaged by a natural disaster, just because the earthquake is over or the hurricane is gone or the tornado has left the area, it doesn't mean that everything just magically rebuilds again. You have to rebuild that infrastructure, and you need resources to do it. And if her cells were depleted to the point where she just wasn't able to heal and recuperate as quickly as possible, or as quickly as would be ideal, then maybe that's why we were seeing her energy and brain fog just being pretty stuck, where brain fog is essentially a tired brain for all intents and purposes. It's a ATP or mitochondrial dysfunction leading to suboptimal ATP or cellular energy in the brain. And so in her case, I recommended she go on comprehensive mitochondrial support, and sure enough, within a month, energy's picking up, brain fog is going down. Follow up about 6 to 8 weeks later, doing even better. And so then flash forward about 6 months, which is the consult that we had just recently, and she's still doing really well. She's maintaining, and it's just really, really great, really exciting, because she had been plugging away for so long trying to get her energy back, and she's feeling really good. So with her case, she's still working with the mitochondrial support at this point in time. I'm a little bit leery to lower her dose at this point because I don't want to have anything backslide, but at some point we will start backing off, and probably the next time we chat, if she's still doing just as well, we'll probably start tapering things down, because it sounds like her mitochondria are doing quite a bit better. In terms of comprehensive mitochondrial support, basically, my definition of that is working with robust dosages of all the various nutrients that the mitochondria need to function. So that would be certain vitamin and mineral cofactors, certain antioxidant cofactors, certain antioxidants that help to establish optimal redox balance, or oxidation reduction capacity in the mitochondria, which is very important. And then also agents that help to promote mitochondrial biogenesis, and that can include different agents, whether it's creatine, or something called PQQ, or possibly resveratrol, quercetin, things like that. And so it's using all of those things in robust dosages to make sure that the cells have everything that the mitochondria within the cells have everything they need to make energy. In terms of giving robust dosage of all of those ingredients, there are a couple of formulas that we use in combination that cover all of those bases. So it's not like patients have to be taking 30 bottles of different things. We have these combination formulas that get it all into a very concise form, and so therefore it is quite user-friendly. It doesn't taste great. One of them is a powder, and nobody likes the taste of it, but c'est la vie. I take it every day for health maintenance, and I don't mind the taste that much, but it's all it's not the tastiest stuff on the planet, I will admit. So in terms of mitochondrial support, it can be so incredibly helpful, can be just a game changer for a case that's otherwise stuck, as long as the case makes sense. That it looks like we just need to get those mitochondria up and running, and it's something that I'm excited about every day, because I've just been seeing such good results with it in my patients. So I wanted to share it in this video.